there's so much investment in healthcare right now.
What is charge capture?
They now have to understand they have to be involved and they have to be engaged.
Hello and welcome to the RevTech Rx Podcast powered by Avelead. I'm David Kozlowski, and today we're talking about staffing shortages. I've got with me Jawad Shaikh, CEO of Avelead, Micheal Kittoe, a CFO in the healthcare space, and Micheal Yzerman, Senior VP of Services. Micheal, you're the guest today. Do you mind just giving a quick little introduction as to who you are in the healthcare scene?
Sure, David. I'm a CFO that is from a unique path. I have 20 years clinical experience, and about 25 years ago, a CEO of a hospital approached me and said, "Have you ever thought of going to the finance world?" And so I took the challenge on, and I've spent last 25 years as a CFO in 4 different institutions, and I feel very blessed that I've had 2 careers in healthcare, both on the clinical side and on the financial side.
It's awesome. We're really thankful to have you here today and excited to deep dive into staffing shortages. We've got this whole layout. So first, I just want to ask to set the scene, what is the current situation of staffing shortages in healthcare right now? For people who don't know, give me the high level.
I'll kind of give it's a wider outside of even healthcare right now, right? Everybody understands what's going on with COVID. But one of the direct impacts within healthcare, right? So I'll start on the clinical side with nursing, right? There's these mandates that are putting in place, and I'm not going to get into political. There's people that mandated vaccines against, but that's having an impact on staffing, nursing, revenue cycle, back to even janitorial services and cleaning the beds, and then you add on top of that the Great Resignation and people wanting to work remotely. So that's created a lot of challenges throughout the industry, but specifically healthcare as well too. And I'm going to let Micheal add on to it, especially from a hospital perspective.
Sure, Jawad. It's absolutely been a challenge for us. We've had what we call travelers that we have to bring in because we just have shortages. Every bed's filled in the hospital. You got to take care of the patients, and we're paying excessive premiums for these travelers. And then to compound that even further, you have your existing staff, nurses that are approached by these companies, and they're offering extremely good benefits, extremely high pay, and the nurses are taking those challenges on and they're leaving our organizations. So it's really just been a vicious cycle of trying to make sure when you're at full capacity for patients that you have your staff there to take care of them on the clinical side. And you mentioned the back office side, equally as challenging. And that's really been a unique opportunity for us in healthcare on how we are able to learn to work remotely. You know, the industry of healthcare, that's been a challenge for us sometimes to figure out how we don't have to always have everybody in the office, but we had to learn. And along with that comes challenges too, because now you got to set people up in their homes from a technology perspective. How do they work from home and be productive? So it's really caused a major disruption in healthcare. And I think healthcare is rising to the occasion.
I want to touch on something. You mentioned that there's this contractor or a travel nurse or role, right? Mm-hmm. That is way higher paid, better benefits. And it sounds like the hospitals are employing these travel employees in general, right?
Yes.
But that some of them are leaving to go for the travel job.
Correct.
So, and just thinking, what is stopping the hospital from trying to match already? If they're already going to lose the employee to this higher paying job, and they're already going to they're already having to employ and potentially pay more than what that company's even paying them, why not just rise to the occasion to offer the same money and the same benefits? Yeah,
that's a great observation there. And it's a delicate dance from my perspective, because you're absolutely right. Where's that ROI, that return on that investment of losing that person and bringing somebody in at a higher pay? Why not just pay them more? And you can only play that dance for a short time, and then it becomes it's self-defeating, because you're just constantly increasing. And so I think what we've learned is that you really have to look at not just the dollars, but the environment, the culture, and how you can make it sticky from those types of things as opposed to the salary.
Those are factors that are also contribute to whether it's the economics or the operations of healthcare and hospital operations, especially, that are also have been going on for a while. That is another variable or another factor with staffing and retention and operating costs and so on and so forth that impact this as well.
Yes.
And it sounds like, if I'm kind of reiterating what you stated, once you raise the bar to this new standard of pay, that contracting company is potentially going to raise their bar, right? And then it is like this vicious cycle of where do you find the appropriate pay or price while not affecting patient care or not affecting the increase in price of the services that you're looking to get. Am I understanding that correctly?
Correct.
Yeah.
Yes.
And remember, in healthcare, which is a service industry, right? It's taking care of people, it's being physically present to take care of people. So where we have this broader trend of remote work and work from home, and in a number of positions in hospitals, that can apply. Bedside care, or direct service delivery, point of service delivery, people have to be there, and and you have to support that model with all these other competing opportunities. And in medicine or in healthcare, you have telehealth, which is more attractive for some clinicians if they want to really take advantage of remote work. But at the end of the day, there has to be people in the hospital or in the clinic or in the setting to provide direct care.
Well, staffing shortages, right? What we're talking about. Second is the type of work we're trying to do, where, hey, as a back office person, I could be remote, but as a nurse or a care provider, you can't provide that remotely, right? But now when you throw telemedicine in the mix, the patient himself is remote. So it's like not just staffing shortages, but the new way of getting the work done, whether that's telemedicine, whether that's remotely working from the back office, and whether the traditional way of, hey, I got to have patient care directly. The other part, to kind of go back to your point, is with the staffing agencies, is it's kind of I call it the dial approach, right? It's what's very hard right now with the influx of the care that's needed, right? We'll have a lot of patients or have you patients. Traditionally, I bring in staffing agency where I need more resources for this week or for this day or for this month. And that's why you pay more for that. And that's why that cost is higher. What's become is there's a shortage across the board. Now there's a constant need for more and more people, where you can't just, I have a job for 30 days, I'm getting paid higher, but it's not, I don't have that, I know a permanent job that I'm gonna have for a long period of time. So that stability is not there, but just the need that right now has created that stability and that at that higher cost as well. So it's kind of harder to manage that dial.
Yeah.
Well.
Right.
So
Yeah.
When you mentioned that there are other things that you're kind of trying to implement outside of just pay. And I want to touch on one thing because I'm curious and pretty passionate about his culture. And I'm curious, anytime I've met someone who works in a hospital, it's, you ask a nurse, like, how's work? Oh, they're just like drained, it seems like. What have in your time recently, have you seen a pretty hard shift in culture? And do you have any examples of what that might be?
I think it's really some of the small things that you can do. As an example, when we're got full capacity of patients in the hospital and you're staffing at what I would say is kind of the minimum level, it's hard for those nurses to leave the floor. So we, one small example, would make sure that food was brought up to the floors for them and they could have a proper break in their room. And we, as the senior administration, would make an effort even to deliver that food up there and just make sure that you're staying connected with the caregivers at the bedside and that they have the proper nutrition and support that you can have. So it's really some of the basic things.
Yeah, it's amazing what appreciation can do, right? Yeah. To keep morale up. It's great. So we're talking about, we know this issue now. We've set the baseline. It's a problem. How do we start to mitigate it?
from my perspective, I think it's a couple of different things, and I'll apply it to like the healthcare side. The first thing I think you do is just there's so much work to be done, and then you have so many resources. So once you know there's a shortage, it's kind of like triage, right? And I was using an example of a friend who was an EMT. You go into an accident, you see somebody, there's 10 people that are injured, and you have to figure out who you can't help, who doesn't need as much help, and then how do you pick and prioritize those? So it's kind of a prioritization, I think, is step one, to say, this is what I've got the staff to do. What's the priorities I need to focus on? And being able to understand and identify that, I think, is probably a key first step. So,
and building on that, it's important to keep the people that you have, right? And then as effectively as you can, recruit and onboard those additional people. And then a concept that I learned from a mentor and a friend years ago, the concept of highest and best use, right? Mm-hmm. You want people doing the work that you need them to do, but work that they're passionate about. If we talk about nursing, for example, a nurse, he or she wants to focus on patient care, wants to focus on the profession and the science of nursing. They don't want to focus on paperwork. They don't want to focus on the ever-increasing administrative tasks and activities that even the most frontline individual, nurse in this example, has to do every single day. One would argue a highly trained, highly committed, passionate nurse, the highest and best use is not having that person fill out paperwork. So to Jawad's point, one, how do you identify what the priorities are? But then how do you staff for that, right? Is it possible? And we'll probably speak a little bit in terms of remediation around automation, those routine, mundane tasks that leverage and enable the highest and best use of your staff.
Yeah.
Now, I was the last HFMA event. This was about a month or so ago. I was actually talking to a CFO of a South Alabama hospital, and they were having staffing issues with patient registration or patient access folks, right? And it happens to be Patient Access Week, and that's why that came up this week. And even doing the simplest things of having patients pre-register, fill out their information all online, they're not sitting there. Even from a patient perspective, I don't have to refill out the same paperwork. Just those small things make the timing of registration go back quicker for the patient access, your employee, but also for the patient that's registering as well too. So you can make those things a little bit more efficient as well.
Yeah, those are all great examples of what you have to do, and making sure that automation is working for those points. And then, Michael, to your point, when you talked about the working to the best of their abilities, we like to talk about that working at the top of their license, mm-hmm. and making sure that all that critical work that nurses are trained for, they're able to focus on those, and anything that was not really that another person can do at a different level, make sure that work is being divided up.
And that speaks to that cultural, sort of connecting to purpose, that cultural element, right? Where, have a passion and have a commitment to human life and caring for others. Right. It's really, how do you maximize that and minimize all the rest of it? And of course, try to balance the economics of healthcare and the state we're in this country and in the world in general. How do you balance those economics around equal and fair compensation for staff?
Is it recruitment or is it retention? If you had to put a percentage on it, like, is it people leaving because they just don't want to, they want better opportunities, or is it we just can't find staffing?
Yeah. Yes.
To all of it, all the above.
Well, recruitment is retention, right? That's bringing on the right people, right, in the right role, with clear understanding of what the role involves. Hiring right as the example, and then it's through the course of every day, making sure they're connected to purpose. So the organization not only has mission, vision, values, but is able to communicate and articulate those in a way that all employees can understand that and understand how their role supports that or does not support that. It gives them direction. It gives them that sense of purpose, and also gives them an opportunity to self-select. This is not the place for me. Many times employees leave an organization for reasons that may not be formed on facts, if you will. if you do not express to your employees kind of what your mission, vision, and values are, it's hard for them to understand their place, and it's hard for them to join and belong. Because we're really looking for employees that, are engaged, that are motivated, that are passionate about their work, they're happy in the work they do, and they find that work rewarding. Those are the employees that are going to move the organization forward because they're committed to that organization. That starts with recruiting the right kind of person, right? And that's about fit.
That's a very good point, and it kind of goes to how we're trying it all back together with supporting your team and the culture aspect of it. That's so key.
Yeah. I think there's 4 things that I wrote down. One is competitive pay. It's one of the dials, right? Ease of use I had on here, and that's really I want to deep dive into that because that's one we definitely have a little bit more control of, especially with this group in terms of the finance side. Culture is important, and then allowing the individual to do what they love and making sure that they can stay, doing what they love. And I think the doing what they love and the ease of use are really close to each other because we do have these documentation, like they have to fill out documents, they have to write, or they have to chart, whatever the case is.
Right.
And having systems in place or tools in place that makes that easier, foolproof, if you will, that probably allows them to focus on what they care most about. If we're talking about nurses, we'll say patient care, right?
Right.
Which kind of brings to the next conversation, the next point is that what tools could be utilized to make this or expedite this process, make it easier so that they can focus on what they love, they're passionate about.
Yeah, to me, I mean, it could be something as just simple as just changing a process, right? It's not just a tool, right? It's like, here's a tool and go. A lot of times we fall into that trap of, hey, here's this new great software, or hey, there's a new solution, let's just go implement it and do it. I think it's more of a solution where you look at, hey, what am I doing to, one, supporting the team like we talked about, and what can we do to make their lives easier? Is there a solution or a tool or a process change, right? Hey, let's do this instead of this. So it's not just a tool's not the answer. It's a tool and it's technology and it's people and processes that makes their life easier. We talk simply about, filling out forms, right? If the patient pre-registers, or if I'm able to take something that's already in the system and automatically do that for me, and I'm focused just on my gaps, that's reducing the workload or something that ties into that, rather than, I think lately or historically, a lot with these EMR migrations, everything's let's push technology, where it should be what's the solutions, what's the workflow, and how can we help our care providers or the back end folks make their lives easier.
Well, as a CFO, I like this conversation because I'm hearing that you're not coming and asking for the technology first. Let's look at our processes. Let's look at our people. And if we can, tweak something there without the expense of the technology, that should be our first line defense here. Because we're already strapped. We talked about the shortage of staffing already and the excessive salaries. So expense control is more important than ever right now in healthcare. And so fixing it with process improvement and that is first line defense.
And we've talked a whole lot about nursing. I think we're just making it easier for the conversation to be that generic. But even outside of the caregivers, we talk about our physicians, our providers, who very, very similar challenges. With the addition of increased litigation exposure, increased risk on all of those kinds of things. But it's throughout the hospital operations, whether it's your revenue cycle staff, whether it's your environmental services staff, everybody that it takes to operate a healthcare facility is vitally important, because without effective environmental services, you don't have a healthy environment to care for patients. So it really is a top to bottom, side to side, end to end kind of process and situation. Although we talk about nursing in this specific example, that's just one example of the challenges that operators have to address and have to be focused on every single day.
Yeah, and just to add on to both what both Michaels just said is, I think a lot of it is identifying what those solutions or what those best practices are, right? The best processes are, and then in some cases you are short-staffed, and when we talk about prioritizing the processes or prioritizing your system, You might not be able to follow a full process, but at least you know what the best practices are. And let's prioritize our most efforts on the ones that get your most bang for your buck. So if I have 8 people instead of 10, all right, those 8 people are focused on the top priorities and kind of getting that done. And then utilizing technology to support that, or how to make it more efficient rather than the other way around. I think then you says, hey, okay, we're doing this and it takes one person to do this. I'm 2 people short, but now I have this technology that can make up for 3 people.
Sure.
I think that's the way to kind of look at it, I think.
I think to kind of follow up on everything related to this, if you're implementing technology, what is the potential backlash at the hospital, right? Why I'm saying it like that is that an experience of doing go lives in the past, some people are very apprehensive of implementing technology. Do you find that that is a common theme, even if it is potentially going to make life easier or faster?
Yeah,
Change is hard for everybody.
yeah, there's probably hundreds of examples of how that is, but common to many of those examples would be there's fear of either job loss or significant job change. You know, that you're bringing in this technology, and individuals at first have to confront that fear that they have. Like, does this mean that I'm going to lose my job? And so that's a real factor that as technology changes and rolls out, that we talk about culture earlier, that can really beat culture.
Yeah, organizational change management is often overlooked, you know, and there's a number of things you can do to address that. One is clearly communicating sort of the why of the technology. What is the purpose of intent of this? And what does it mean for me, whether it's my department or my job, to allay fears of, you know, am I going to lose my job? But practically, there is a lift, if you will, or a burden on staff to implement technology. So in many cases, it's simply the practical matters. I don't have enough time to do the work that I want to do, that I'm supposed to do, and now I'm doing this on top. So it really gets to be, you know, communicating clearly what the intent is, what the purpose and outcomes are, what an individual's role is in that, and to the extent of helping them balance, if you know, the duties they have with the new activities that are coming on board. And as Micheal pointed out earlier, taking the opportunity to look at your process, your current processes, and how the tool can best enable those processes. And candidly, sometimes processes have to change. Lots of times it's make the technology support what we currently did. Well, if that was an overly manual process, that sort of defeats the purpose of the technology. You need to meet in the middle, and you need to help people through that change, because in many cases their jobs are going to change. You're gonna start doing some things you didn't do before. You're gonna keep doing some things you did do before, and you're going to stop. You're gonna stop doing some things. If it's just I'm gonna do my old job and do my new stuff on top of that, you could understand clearly why somebody might be resistant to it. I already have enough to do.
Micheal, you make me smile here, because earlier when you mentioned about, not, if you don't change the process, you can't just put the technology on it. In my career, I had a stint as dual CFO, CIO, and we were doing a systems implementation. And my mantra became like, we're just paving the cow path. And unless you change that process, you're just hardwiring bad processes in place. So it's extremely important that you kind of rethink the whole processes before you address it with technology.
Because the investments aren't cheap, right?
And they're not easy either, right? And I think people are stuck in the status quo. So if we didn't have like the Meaningful Use Act or the Affordable Care Act, whatever, we would not have moved to electronic medical records the way we did. Now there's other regulations that are coming up with, price transparency, and then No Surprise Act, all these things. So sometimes you need regulation to move healthcare forward. Because it is hard, and people are kind of stuck in that status quo. And people are kind of finding that change, right? They're used to it, they're comfortable in what they're doing. So I think it's twofold. It's which is a generic for everybody. Change is hard. How do I do something that's beneficial to the wider organization, to the wider community? And that kind of helps as well too. I should be able to get my lab result when I go down across the street and be able to see my doctor's office, and those things have just been historically hard in healthcare.
Yes.
And that becomes the challenge, right? That in order to facilitate and adapt and adopt change, you have to engage the people that are going to be impacted, right? The challenge is, how do you do that on top of everything else they have to do?
It sounds like we haven't solved staffing shortages, but there is definitely a thought about it, right? It is figuring out how to be able to handle competitive pay. It is defining a great culture and making sure things are sticky, as you put it. And then I think on top of that, it's figuring out where our gaps are and our processes are that we can improve to allow the individual to do what they're passionate about and what they love. And while implementing tech may be a solution to this problem or one of the problems, there is growth and potential issues with change, and to mitigate that accordingly. And leaving and ending this conversation just due to time, I'm curious, in terms of implementation, in your experience, how do you keep staff's morale high? How do you keep them positive through the transition of tech, and sort of alleviate making sure that you keep retention during this process? I've experienced too often where you're implementing your product and people are like, I'm out, I'm leaving, I'm over this, I don't want to be here anymore, I'm going on strike. Yeah. And in today's world, with everything that you're trying to keep up with, because it's a lot, right? It's hard to implement a culture. It costs money, it costs time. And then same with competitive pay, that costs money. How are you alleviating that?
Food is a great motivator.
Just give everybody free food, call it a day.
Yeah. But I think Michael's said it several times. It's really during that phase of implementation, be very mindful about what you're asking them to do, because they can't look at this as just, I'm doing my full-time job and now you want me to do this on top of it. It's really that dedication of creating that during that implementation phase, your super users that, can be pulled away from their duties to really invest in the process change and the implementation of the technology. And then they're going to go back and take it to their colleagues and really make it work.
What are we doing today? What am I doing today in my job today that's helping with our overall vision and mission, right? We talk about technology is still necessary, right? So it is a key requirement to put all these changes in place, but how does that tie into making the life easier for the revenue cycle person or the nurse or the care provider? And how does that tie into taking care of the patient, which then helps with their patient care and they're able to have a better, successful life? So to me, it's like just tying everything that I'm doing today or my team is doing today or the team itself is doing today. How does that tie back into helping the patient, right? Or helping the community, right? Tying it back to purpose.
Yeah.
Perfect. All right. Any last thoughts before we get out of here?
No, thank you for your time.
Yeah. Thank you guys so much
for being on.
Thank you.
Thanks everyone for listening into the RevTech Rx podcast powered by Avelead. I'm David Kozlowski. Make sure you like, subscribe, review. See you soon.